Okay, let's keep going. And in the prenatal development, another important thing is the gender, right? Let's look at the gender. We kind of talk about this in Unit 1 when we talk about the DNA. And in human, we have 23 pairs of chromosomes. 22 pairs, we call them autosome. Both male and female are the same. The last pair is the sex chromosome. In male is XY, and female is XX. So turn out is the sperm is the father decide the children's gender, because the egg is always X. And if the sperm is the X chromosome and the zygote will be XX, there will be a female. And if the sperm is the Y and the zygote will be XY, there will be a male. So these are those karyotype. Karyotype means the chromosome line up together. And the last pair, that's the sex chromosome. The other 22s, they are autosome. And during the embryo development, you need the Y chromosome to trigger the embryo develop into the male. So the default type is female. And if nothing happens, the embryo is going to develop into the female. On the Y chromosome, you have a gene called SRY gene. This gene will develop testes. And the testes is a endocrine organ produce male sex hormone, testosterone. So during embryo development, you need to have testosterone, this hormone, and to trigger the embryo develop into the male. And if you don't have enough testosterone, or for some reason the embryo could not detect testosterone, we're going to talk about the testosterone insensitivity syndrome. And if they don't have this, or they don't detect this, or the embryo is insensitive to this, all the embryo is going to develop into the female, because the default type is the female. And that's the embryo development. So about second trimester is done. During the embryo development, you need to have the SRY. So before the second trimester, if you have the SRY, that gene gonna trigger testes development, and testes gonna develop testosterone, so it's gonna develop into the male. And without the testosterone, or the embryo does not sense testosterone, it's gonna develop into the default type, which is a female. So that's the default type. And if the embryo could not feel testosterone because of the testosterone receptor, so each hormone have to bind with its own receptor. Like the diabetes. Okay, diabetes 2 patients have insulin, have enough insulin. Diabetes 1 is they don't have insulin, so they have to inject insulin. And diabetes 2 patient is their body have enough insulin, but their body become insensitive to insulin. So they won't be able to lower their blood sugar low enough. So they have to watch the carbohydrate they eat. So that's the insulin insensitivity. Okay, and similar here. If the embryo is insensitive to testosterone, so even though it's XY, and the embryo develop testes, and testes release testosterone, so far so good, but the embryo is insensitive to testosterone. And turn out, well, the embryo will say, well, okay, there's no testosterone, because they could not feel testosterone. And it will develop into the default type, and default type is female. So that's the androgen insensitivity syndrome. And the Jamie Lee Curtis, or everybody know her, she has a very nice body. She actually have this syndrome. So she look exactly 100% like a woman. Or she look like a woman. She is a woman. But turn out, if you take her chromosome, she is actually XY, and because she had this syndrome. So during the development, even though her body have testes, have testosterone, and her body is insensitive to this, so the embryo developed into the default type, which is the female. So she has a perfect female body, but biologically she is XY, and she's married. She has very good family, has 4 kids, all adopt, and she could not have baby because she's XY. And she's not the only one. All these girls, all these ladies have androgen insensitivity syndrome. So it turned out the body is insensitive to testosterone. And when we talk about the endocrine system, we only have one slide to talk about the endocrine system. Your hormones also affect your whole body. And that's one example. Okay, in the prenatal development, I could not talk. In the prenatal development, a lot of drugs, medicines you take can go through placenta, so it can reach the fetus. And if the woman drink, it's very dangerous, or using drugs or smoke, it can all affect the baby. And the notorious one is the fetal alcohol syndrome. And when the pregnant woman, they drink, the alcohol free pass through the placenta, so it can affect the baby. And we talked about this in previous chapter. It can cause the facial characteristic, and the serious part is it can damage the nervous system. So this picture show you, okay, how much alcohol that woman drink and what's the chance of getting the disease, and it's a linear relationship, it's positively correlated. So it doesn't mean that you drink is guaranteed you're gonna have it. It's not causation, but we do have a positive correlation. Means the more the woman drink, the higher chance they can have children with this syndrome. And it can seriously damage the nervous system. It causes the permanent damage. So don't drink when you're pregnant. And we talk about alcohol. The alcohol is a tranquilizer. So in the nervous system, we say the alcohol gonna promote GABA, the inhibitory neurotransmitter release. And during the embryo development, there's the time the nervous system just developing like crazy. They do mitosis every minute because they need to develop into 100 billion of neurons. That's a lot. They keep dividing. And then you drink alcohol, you're gonna release GABA, ask it to slow down. So it turns out you're gonna inhibit the nervous system development. It could cause permanent damage. And there's no safe dosage of alcohol. Don't drink alcohol. Okay, next one. Next one is smoking. And we all know smoking can cause respiratory disease. Inside the cigarette, you have a lot of chemicals, and also the carcinogen can cause cancer. But that part is not for the baby. So it can cause respiratory disease, like fibrotic lung disease, or any other kind of lung disease in a mom. And it can cause the lung cancer of the mom, but not the baby. In the baby, if the mom smoke, it turns out it can cause miscarriage and prematurity of the baby. The reason is smoking. Like this lady, she complains, okay, those noise can harm her baby, but she is smoking. It can constrict the blood flow to the placenta. So that's the main reason. And the baby all depends. They don't breathe. They depends on the mom's blood to carry oxygen to them. So when they constrict the blood flow to the placenta, the baby's brain does not have enough oxygen. That's the main reason to cause this. So it can be miscarriage, can be premature. And if everything goes all right, take about 9 months and 7 days, and the baby is calm. Right? So the baby will turn, the head gonna turn down, and the most difficult part is the head. So the head can come out, move in, come out, move in for hours. And after the head come out, and the body can easily be pulled out. And after the baby is out, another 10 minutes, placenta come out. And after placenta come out, now we have a baby. Now the baby is born. So I have a video, if you like to watch it. That's the giving birth procedure. So that's the prenatal development. Now the baby is born, we're going to look at the postnatal development. That will be our next slides, next topic.